I don't know whether they intended to or not, but they have provided a perfect segue to the next panel, which is I'm going to ask Davis Sharon, boy, I got it wrong, Chacon Hurtado, to bring his panel up. The topic is addressing inequities in public infrastructure. And when you talked about gentrification, or the question arose about gentrification, impacts of our efforts at sustainability, that's exactly what I think the next panel is going to talk about, you know, when we talk about infrastructure, we're talking about building new buildings and taking down old buildings, and it's always advertised as we're going to give people a better place and a better condition, and what we mean is we're going to move them out and move somebody else in. So with that, bring up the next panel and we'll go. That's my personal belief. That's not a whatever. Thanks very much. Did I get close, Davis?
Yep. That was great. Okay, let's get it started. Good afternoon, everyone, to here in Washington, D.C. Good afternoon, good morning, actually, for some, and good evening for those joining us from different parts of the United States and around the world. My name is Davis Chacon Hurtado. I am an assistant professor in the School of Civil and Environmental Engineering at the University of Connecticut, where I also have a joint appointment with the Human Rights Institute, and I am also co-director of the Engineering for Human Rights initiative, and I also co-director of the new center, Thriving Communities Technical Assistance Center for the New England region. Today, it's my pleasure to moderate this panel that is specifically talking about addressing inequities in public infrastructure and its implications in human rights. Today, I am joined by a wonderful set of panelists. Oops, I think that's the ground presentation. So that's the next session. Please upload it. All right, so as part of this session, we'll be discussing some of the important implications that human rights has for the work, particularly of civil engineers, and we'll try to connect this to a specific group of human rights that are called economic and social rights. I wanted to start my story by first allowing my panelists to introduce themselves first. So I will pass the voice to Kimberly so she can introduce very quickly.
Thank you. Good afternoon, everyone, and thank you so much for having me here. My name is Kimberly Jones, and I serve as I'm Associate Provost for faculty at Howard, but more specifically for what we're here today, I'm a professor in the Department of Civil and Environmental Engineering at Howard, and I'm an environmental engineer by training. My research is in water quality, environmental equity in the water sector, and the intersection of policy and research.
Okay. Bethany?
Good afternoon, everyone. My name is Bethany Gordon. I'm an assistant professor of civil and environmental engineering at the University of Washington, and I also hold an adjunct appointment in the Evans School of Public Policy and Governance at the University of Washington. My research is in bridging the social sciences and equity to understand the ways in which engineers and communities can better design together to advance outcomes.
Mm-hmm. And last but not least, Eric, who's joining us online.
Thank you. It's a pleasure to be here. My name is Eric Buckley. I am the director of oxygen engineering at a Boston-based nonprofit organization called Build Health International. I am a civil engineer by education and by background, working primarily as a structural engineer in the commercial engineering industry for a number of years before transitioning over to my current role in the nonprofit sector focused on healthcare and healthcare infrastructure in low resource settings in low and middle income countries, mostly in Haiti and sub-Saharan Africa, with a little bit of work in Southeast Asia and Central and South America. So my role and perspective here today will be one of healthcare and health equity and healthcare as a human right in the international context. It's great to be here. Thank you.
Thank you, Eric. Do we have the right set of slides for addressing? Okay. All right. So I will start with Kimberly, so she can start her presentation while we figure out what happened with the other slides.
All right, good afternoon. I will get started. I guess this is... So I was asked to address inequities in the water sector. That's something I have thought about quite a bit. Specifically, in the last probably 10 years ago, I started my career as a traditional environmental engineer. I designed, water treatment facilities. And then probably in the last 10 or 15 years, I became more interested in really how researchers like myself, how we do research in a lab. We have a vision, we do design, a vision for a water treatment facility, for example. And then really thinking about how that's actually translated into use. And so because as an environmental engineer, what I'm very aware of is that designs that we may come up with, it affects people's lives every single day. And so I became more interested. And I also chair EPA Science Advisory Board. And in that context, we do review science behind regulations. And in the water treatment industry, we design to regulations. That's something that we do every day. And what I want to talk to you about today is really how we have what we hope to accomplish through good design, through regulations, and what people actually experience on the ground. There's a disparity. So I want to talk a little bit about that today. So in 2010, the UN General Assembly said that the right to safe and clean drinking water and sanitation is a human right. And so we've heard a lot of folks today talking about human rights. And so access to drinking water that is safe, that is plentiful, that is physically accessible, meaning it takes no more than about 30 minutes to get your water, is sufficient. You have enough water to support your daily needs. This is a human right. It's not just a human right to have the water, but the right to water really is essential for the full enjoyment of life and all other human rights. Without water, we will die. And so this is, I think, one of the most basic human rights. But in the midst of all that, we have a global water crisis, and we have for years. And so these numbers, those of you who are probably very well aware of this, 821 children die from water-related diseases every single day. We have about 1.8 billion people with no on-premise drinking water. 115 million people collect drinking water directly from surface water such as lakes and rivers, so that is untreated. 2.2 billion people lack access to safely managed drinking water services, and we lose about 18.5 billion in revenue from avoidable deaths from lack of access to basic water and sanitation. And right here in the United States, we also have a water crisis. This is something that, despite many years of regulations by EPA and state regulatory agencies, we know that we have between 9 and 45 million Americans receive water from a source that violated the Safe Drinking Water Act in about a 30-year time frame. 63 million Americans exposed to potentially unsafe water more than once during the last decade. Somewhere between 3 and 10% of U.S. water systems are in violation of the Safe Drinking Water Act each year. And we need to invest about $384 billion in U.S. water utilities to meet water regulations. So despite years of regulations, we still have really large percentages of people in this country and around the world who do not benefit from all of our excellent engineering, all of our carefully science-backed regulations every day. And so it's interesting, when we hear about all of these cases, affecting different communities, what also becomes clear is, where are these communities that are disproportionately affected? It is not, some people think, well, water is piped to a city, it's piped to everyone, equally. And so you wouldn't think there are these disparities, but we know that the burdens of this water crisis affect communities very disproportionately. And so we think about these water justice and environmental justice. I heard Professor Waterhouse before this talk about his journey to where he is now. And similarly, what interested me in the field of environmental engineering, I'm a civil engineer. I wanted to be a structural engineer. I had an internship one summer, and someone mentioned, at that time it was called environmental racism. And then that was the first I heard that term. And the engineer said, we need more people to become, to enter the field of environmental engineering and to really sit at the table and be invested in these communities that are disproportionately affected by these issues. And so right then I pivoted and decided to focus on environmental engineering. That's, kind of been my journey ever since. And that was probably 30 years ago. And now we still see so many examples of environmental justice violations in many parts of the United States. And many times, I remember back when the issue happened in Flint, Michigan, which, was all over the papers. And I got a phone call and someone said, oh, can you give a statement about this, with the science behind this? And I said, this is not an engineering issue. This is an implementation issue. This is the way we're implementing. The folks in these communities there was not an engineer who misunderstood what he or she needed to do to get the water safely to those people's homes. These are policy decisions driven largely by economics, by finances, by how expensive is it to really provide adequate infrastructure to pipe water to these people's homes, for example. And so we have to talk about the intersection of engineering and policy and finances and management, because all these things have to align in order to deliver safe water safely and consistently to these communities. So how can we address these inequities in the water sector? We need infrastructure investment, so we need to specifically target underserved communities for upgrades, and this is not cheap. This is something that a lot of folks really don't want to think about because it does require financial investment. And so folks do have to step up to the plate and really have a targeted investment in these communities. We need to have community-led initiatives. So these are not places as engineers we're really taught, okay, you're an engineer, you're a professional engineer, you're the expert, you make your designs, you can stamp your designs. We have to go beyond that. We really have to start working together with communities to really try to figure out how to best design so that they really meet the needs of the communities that we're hoping to help. Policy reforms. We really need to implement regulations to ensure affordable access to safe water. And so stating or setting a maximum contaminant level goal, or stating best practices or best available technology for water, that's one thing, but really thinking about how can we set these policies so that water can be affordable and it can be reliable and it can be safe. Capacity building. We need to provide training and resources for sustainable water management. That means upskilling members of communities so that we have professionals in all of the communities who can really work together with those in their community to really make sure that their water system remains safe. And how do we consider human rights? As we do this, we have to recognize that there are disparities. And until we really recognize that and acknowledge it, we really won't get to where we need to be. We have to involve communities in these conversations. This cannot be a lot of engineers, even a lot of engineers and social scientists and lawyers at the table. We really need to bring those in a community who are going to be impacted by this at the table in the beginning to have these conversations. We have to invest strategically. So thinking about how we invest in order to target these communities will also be important to make sure we actually reach those we're trying to reach. And then monitor progress. This is not a situation where we can say, okay, we've made a decision, we've done good, now we can walk away. We really have to stay the course. These things won't happen over a year or 2 years. They really happen over very long time periods. We have to be ready to stay and invest and continue to work in these communities. All right, I had 10 minutes. I forgot. I didn't get to turn my timer on, but I think I stayed under 10 minutes. But thank you. I'd be very happy to continue the conversation in the Q&A.
Perfect. Thank you. Great. So now we'll pass it to Dr. Gordon.
Hello, everyone. Are my slides? Oh, there we go. Okay. I am excited to speak to you today about positionality and community engagement and the role that we need to do to prepare ourselves as engineers in order to engage effectively with communities. Next slide. So I wanted to start off with, thank you. I wanted to start off with this case study by Drs. Kaminsky and Faust that looked at water and sanitation utilities for climate refugees in Germany and asked the question, when is infrastructure a service versus a right? So displaced persons who are coming into Germany may or may not have jobs yet. How long are we providing that service to them free of charge? And survey respondents were willing to provide those water and wastewater services for approximately 2.9 years. It's a very interesting paper. Ultimately, a lot of the discussion focuses around the fact that this is a deeply contextual question. So this is one number that they found. But context is really important, and I think that's something that we've been echoing over and over again today here. Drs. Kaminsky and Faust pointed out a lot of context around existing policy and system capacity to meet demands as factors that we need to consider. Is the infrastructure required in place? I focus a lot on these other three contexts that I wanted to bring into the conversation as well. So that's awareness of historical context, positionality of decision makers, which I'll define a little bit later, and sense of community. All three of these things lead to effective community engagement, a place where engineers may have not felt at home traditionally, but I think we need to start moving in that direction, as Dr. Jones pointed out. So the first aspect is that understanding history matters for equitable decision making. As I mentioned, I bridge the social sciences with engineering. One thing that I take from the social sciences is the social psychology principle known as the Marley hypothesis. So as bullet number 1 says, the Marley hypothesis shows us that knowledge of racial history affects the way that we perceive systemic racism in society. So if we don't really understand the context in which things are happening, we might not even be able to see and recognize that that racism is there. So as engineers, it's important for us to educate ourselves on the history of the places that we're going to. I implemented this in the context of a climate adaptation scenario, and that's bullet point 2. So when participants were given that racial history context, in certain cases, it did affect the way that they distributed climate adaptation resources. That's something that we're still sort of parsing out in terms of which contexts it applies in, but we did find that data in a previous study. Then this slide is really the meat of what I want to talk to you about, because positionality is something that is not a new concept, and it certainly is not new to the social sciences, but I think that we really stand to benefit from it as engineers. So positionality is the social and political context that shapes a person's identity. Often when I teach my students about positionality, they say, oh, but Dr. Gordon, I am an engineer, all of my decisions are quantitative, and my identity doesn't affect what I do. But I answer them usually that the aspects of our social, political, and cultural context that we don't believe are relevant, that's often because they're aligned with the systems in place that other people might be negatively affected by. So we still need to examine them and have that practice as part of our engineering. Part of the way that we can, once we have identified these aspects of our identity that may be influencing our engineering decision making, we move on to reflexivity. So this is a practice. It's not something that you reach a finish line with, but it's this idea of self-reflection. Who are we as engineers, and how does our positionality influence our work? This Jameson paper that I've cited actually brings it into a quantitative context in a way that I haven't quite seen before, so I would recommend checking that out. And then lastly, I talk about accountability and reciprocity. So this is about what we've been talking about throughout, working with communities, making sure that we acknowledge the different types of expertise that are important for climate adaptation and for human rights. So this concept is valuable because it moves engineers from a position of needing to maintain their credibility through holding power, and more so through building relationships and trust with communities. And then I also wanted to highlight a framework for organizational and systemic equity. As we've talked about, equity is deeply integrated with our ability to address human rights. Dr. Carrasquillo, I believe, pointed out these definitions earlier. This paper by Dr. Bozeman and colleagues defines systemic equity as the intersection of these three things. If we don't have all three of them, we're not actually able to achieve systemic equity. And that is all I have for you today. There's my contact information. Thank you for your time.
Okay, great. I think that's my cue. Thank you again for having me. I wish I could be there in person, but joining you remotely here will have to do. Again, my name is Eric Buckley. I am the director of Build Health International's Oxygen Engineering Program. And as I said in my introduction, we are a nonprofit organization based just outside of Boston that works on healthcare and healthcare infrastructure projects in low resource settings in low and middle income countries across the globe. Just from a personal perspective, I started my career as a structural engineer in the commercial engineering world and was connected about 4 years ago with the founder of Shawmut Design and Construction, which is a large US-based construction company. His name is Jim Ansara. And Jim had retired, and in his retirement, he started a new organization, which is Build Health International, which is a nonprofit really focused on building and designing and planning for healthcare facilities in low resource settings. I had thought about getting involved from a volunteering perspective, but an opportunity arose to join as a full-time engineer and make this my career, which was really something that I never really viewed or thought of as possible. But signed up immediately and have been, spending my time over the last 4 years really deeply embedded in the organization and working on a variety of different projects, really focused on healthcare access and healthcare infrastructure, which, again, organizationally, from our perspective, this is very much at the intersection of human rights and healthcare as a human right and health equity. According to the WHO, health equity is achieved when everyone can attain their full potential for health and for well-being. And I think infrastructure plays a huge role in that. And really what's that saying is that your geography should not determine your access to healthcare, whether you are based here in the US or anywhere else across the world. You should have the same access to healthcare, and that's really the work that we are doing. Let's see, next slide here. If I can control that. Wonderful. So as an organization, our mission is really to enable dignified, affordable, and high-quality healthcare for all. And that's really kind of at the foundation of all the work that we're doing, is really at that intersection of human rights and engineering, where we are building the infrastructure to enable healthcare and healthcare delivery. And really, what do we mean by that? How does infrastructure kind of enable healthcare? Oftentimes when you think of healthcare and health access, you're thinking of the doctors and of the nurses and not necessarily the infrastructure components. But as an engineer and from an engineering perspective, the infrastructure really is the kind of the backbone of the ability to deliver care. We've been fortunate enough as an organization, and me personally through the team that I lead, have been able to be a part of dozens, if not hundreds, of existing facilities assessments at various locations across the globe, countries, continents, and contexts. And almost every single facility that we are performing these condition assessments on, we see infrastructure as one of the primary barriers to the ability to deliver care and the primary barrier of access to care as a patient. And when we're talking about infrastructure, it's many different things. It's the structural integrity of the building. It is the sanitation systems to limit the spread of disease. It is the access to clean drinking water for the patients and to provide services. It's the road and transportation infrastructure. Can the patients within the community, can the community members get to the facility to receive treatment? Are the roads passable? And in the same sense, can the materials, resources, equipment get from where they need to be to the hospital to be able to kind of build and provide the services for those facilities? So that's all infrastructure connected. The largest piece of infrastructure that we see that impacts the ability to deliver care is electricity access. And that we see almost everywhere. The access to reliable, safe, high quality, and sufficient power is a huge barrier to care in many of the communities that we've been a part of and that we see. And so when we're thinking about engineering for health equity, engineering solutions for health equity, there's a number of different approaches we take to deliver that. Our team at BHI, we're architects, structural engineers, civil engineers, mechanical engineers, plumbing, electrical, med gas engineers. We're construction management professionals, global health professionals. We have team members that are based in over 18 different countries, I think, at this point. So it's really about bringing all that varied experience and perspective to bear to help develop appropriate solutions for the context and for the problem. And it's really taking that kind of comprehensive approach and comprehensive thinking to develop solutions that are appropriate for the context that solve the challenges that are in front of us. The pictures you're seeing here on this slide are various solar projects that we've worked on across the globe. And again, energy access is a huge problem. And when you don't have access to reliable utility power, the only solutions are to generate power on your own, which is typically either a diesel generator or a solar installation. Both have their challenges and benefits and drawbacks, but it's really about how can we work on developing the solutions that are appropriate for the context in which they're being delivered. Let's get the next slide here. And a lot of that is about what we call building sustainable systems and sustainability. And organizationally, we think of sustainability really in two different buckets. There's the climate side of sustainability, where we're looking at our climate impact and climate resilience. So the systems and buildings and facilities that we're designing, what is the impact on the climate? But also, how do we design them to be resilient to changes in climate and climate change, whether it's increased ambient temperatures of the region, whether it's more severe weather events. And so there's the climate resilience part. But then also we think about sustainability from an operational sustainability standpoint. So how do we ensure the continued functionality of a space? How do we make sure our projects have longevity and are able to operate once we are no longer involved, and that the right training and capacity building and systems are in place, that the projects and the facilities and the equipment are able to operate for a long time and be able to deliver the outcomes that they were intended to deliver. And a big part of that is local capacity building and training. And that's a big part of what we do. The three folks you see here in this photo are part of our construction team that we have in Sierra Leone. So we designed a maternal hospital in Sierra Leone, to the architecture and engineering, and we were working with the partner to identify a local contractor to build the facility. And we really couldn't find anyone that had the necessary skills and expertise. So we have a lot of experience building many of our projects that we've worked on in Haiti. So we decided, well, we'll start a construction company. And so we took the experts and some of the trained professionals that we had developed in Haiti, and we brought them to West Africa. We brought some of our American staff, some of our East African colleagues, and then brought in the local community and the local skilled laborers that are within the community and the unskilled laborers. And we built kind of a construction company really from the ground up. Some of the team members had never been involved in a construction project at any point. But for the experts and for the leaders that we had brought in to develop this team, it's not a secondary goal or a secondary outcome of why they're there. One of their main objectives is capacity building and training for the local team members and the local community and the local construction group that we've built. So when this project is done years from now, that the local team that we've developed will be able to take on the next project independently. And you can see here on this next slide, this is the project. This is the Maternal Center of Excellence. This is the maternal hospital we were building in Hurtado, Sierra Leone. This was the first project I worked on from a structural design perspective when I joined BHI, so it is very near and dear to my heart. This is a photo I took last December on site, so we're about a year further along. But it's really about making sure that the engineering solutions that we're bringing to the table, that we're bringing as part of our designs, are really there for that idea of sustainability, that are appropriate for the context, that are going to be able to serve the communities they're intended to serve for a very long time. And I guess really in conclusion, I mean, from my perspective, again, from being involved in this work, engineers really do have a unique position to advance health equity and health access. I feel like we have the responsibility to design for those outcomes, and every infrastructure decision is a healthcare decision, and every healthcare decision is a human rights decision. So the link between engineering and human rights, certainly when it comes to healthcare access and health equity, is very direct. So that's it from me. Davis, I'll hand it back over to you, and thank you for the time.
Okay, so, well, I was preparing these remarks to open the session, but I will use them to close the session, actually. Well, one of the key things that I wanted to share is how important is to think about human rights when we're doing engineering projects. And I will start by describing a little bit about that background, and I will be connecting some of this to a specific area of civil engineering, which is related to transportation engineering. This was, of course, our set of panelists. And to get us started, let me take you to this Andean community in the Andes of Peru. It's a community located just 1 hour away from the gateway to Machu Picchu, that perhaps many of you had heard about this wonder. And there we also have Mario, whose primary mode of transportation is walking. And when this picture was taken, this community didn't have access to electricity. Most of the families didn't have access to water sanitation. And of course, there was no cell phone signal in this community. And one of the stories that Mario shared with us is that in many cases, for him and his family, to access health facilities, he has to walk for hours after he finishes his labor at the farm, just to arrive to the health center, or Posta Médica, and realize that it was about to close, so they couldn't provide the attention that he needed. It was the same for some of the children that have to attend school, who have to walk sometimes for hours to reach the school that was in the community center, or even, when they have to try to sell their products for even tourists that are going through this particular community. Perhaps some of these stories may sound like, very far away, but we see that what is happening in this community is replicated perhaps in hundreds or thousands of communities around the world, and even we have cities or regions that have significant barriers in access to basic public infrastructure. And we also see that even in the United States, in rural areas, we are dealing with significant issues like, for example, access to broadband internet or some even basic services. So globally, we know that this is a big problem and has been translated in numbers, right? We know right now that there are about 700 million people in the world who suffer from chronic malnutrition, right? And this is one of the leading causes for deaths among children who are under 5. There are more than 2 billion people who do not have access to basic water or safe drinking water at home. And we know that there's a significant portion in terms of access to work of people who are working in the informal sector, and we have about 16 million people who are actually working under what is called forced labor condition. And this is very important for civil engineers because a portion of that forced labor is actually in the construction sector. And probably many of us will think that all these issues are very important, and as engineers, we may think that some of the work that we do may impact this type of issues directly or indirectly. However, we see that engineers still struggle to see a direct connection of the everyday work that they do with some of these issues that I just described, and this has come out already in some of the sessions that we had before. So one of the things that we realized when we started working on this topic at the University of Connecticut is that we actually realized that some of the code of ethics, some of the student outcomes by some of the organizations that give the accreditation to schools, even professional organizations, or even what some of the some of the organizations from the corporate side ask about what are the desirable attributes of engineers, are actually already connecting some of these issues with what we are expected to know from these students, what we are expected to know as engineers, right? So in some way, there's some kind of mismatch in between, one of the most important issues that we have in society and, what is asking us, like what some of these code of ethics are asking us, yet engineers don't really see how to fulfill that. And that's the connection between the work that we have in human rights and the work that we have in the engineering side. So what we're proposing here and what we're talking about as part of this event is that we have these normative foundations that have been developed, as Professor Giannini said, for many years. And we like to say that they have actually teeth, right? That they are able to be applied in very settings where we need action, right? So what we're saying here is that the human rights these human rights documents could help us translate this kind of growing awareness about the role of engineering in society into actionable items, right, into actionable things that as engineers we can actually control, that we can actually do. And in particularly for this session, I am highlighting there what are called economic, social, and cultural rights. So what we're doing is basically saying that we have these needs in engineering. We have already a body of work that has been built for many years and has been applied by people in the legal work. So we just combine those and come out with what is called the Engineering for Human Rights Framework, right? That is based on 5 key principles. And I won't be talking about this, and actually I'm glad that I'm closing this because right in the next session we'll be doing a small workshop where you will be helping me to discover and understand why these principles are important. I just want to point out to one of those, and it's the one in green, that is consideration of duty bearers who is responsible for the fulfillment of human rights. And as Professor Giannini said, we typically expect that governments will be the ones who will be in observance of human rights. And as part of the business and human rights movements, now we expect that companies will also be responsible for the fulfillment, respect of human rights, but now we're extending this to engineers, right? So what we're saying here, and I'm so glad that the discussion about ethics came out, because what we're saying is that as part of the obligations that we have as engineers with our client, with the people that we're serving, we also have responsibility to respect and fulfill these human rights. And this is what we're trying to do as part of this framework. Now, let me give you some examples of how we could do this. But first, I wanted to put this slide about some of the benefits of why an engineering and human rights framework is important. The first is that, well, it brings a new paradigm for engineering design. I'm putting there in quotation because we say it's new, but in reality, as we were discussing in the previous session, and Charles did a great job in the beginning, to say this is not necessarily something completely new. It's simply adding a new language to the work that engineers are already doing and providing some framework in which we can, in some way, enhance or make sure that we are not violating any kind of particular human right. I still say new because it's part of my work as a professor, and therefore I have to say that I'm doing new things, right? So it also helps us to better understand the role of engineering in society, and this is the big important connection between the role of engineers versus what we can do, with some of the normative framework for human rights. And these last 2 points, I just wanted to drop those there. We're not going to discuss a lot about, but it really helps improving the awareness of people and understanding of what engineers do, right? If you start talking to people out there, what engineers do, and then you start telling things related to health, access, housing, then they said, oh, I now understand what engineers do, right? And the last one, which actually came out in the part of education, is that we have seen that this could be a potential area to improve recruitment and retention of students, because they actually see that this could have significant impact in society, right? That really motivates them to do that. So what we do as part of the education of engineering for human rights is just discuss, as Professor Hurtado, my colleague, highlighted, is really talk about these 3 particular areas related to the Ruby principles of preventive approach. That an example is, for example, Title VI, right? Or even like what has been discussed in the previous panel about environmental justice. How is that you can include some of this as part of no, do not harm, right? Do not cause any kind of violation using the indivisibility of rights in any kind of like human rights to the people that you're serving, right? The other one is the remedial approach in which like we're thinking about, for example, about forensic work that engineers can do, right? Or when we do environmental remediation. We have a really nice program at the University of Connecticut, which is called the Brownfields Program, that is a center that invests in giving technical training to communities so they can apply for grants to transform some of these brownfields that are out there, right? And finally, and the most important point that was highlighted is really the proactive approach, is how as engineers we can actually make part of our work, part of the work that we're doing as engineers to fulfill human rights. But again, it's not just like I'm doing housing and I forget about all the other human rights. This is where the principle of indivisibility of rights will kick in. And then we'll discuss in a moment why that is important. How do we do this to teach engineers? Well, the first thing that we do is to explain how the issues that we discussed in the first slide are actually connected to human rights. When we're talking about access to food, access to education, housing, those are actually related to specific economic and social rights. And I'm just giving here an example of 3 key human rights related to economic and social rights. And the key concept here is the progressive realization of human rights, which means that we'll be working towards fulfilling this in the future. But at the same time, as engineers, we have to be aware of another group of human rights, as I say, the civil political rights, that those require immediate attention, right? Those are not things that I can fulfill in the future. And then we could also talk about traditional things that we do as engineers, like, for example, access to employment, access to health facilities, as you can see in the first figure. But now we could be talking about those same like analysis, the same formulas, but now instead of talking just about health facilities, we're talking about the access to health. And also, again, looking at some important aspects that should be considered as part of this analysis of, freedom of discrimination, which is Article 2. And this is just an example of all 30 articles that we have in the UDHR. And there is the example of the bus, and even historically how this language of advocacy and search for what is fair and just, it could actually be framed under a human rights framework too, right? And one thing that sometimes I feel is interesting, that transportation in particular has been key in many movements, right? Like, for example, the civil rights movement in the US. However, it's not a human right per se. And this is an important point to consider, because as this came out in the first session, there's a whole family of aspects in which engineers could help, which are called instrumental rights, right? In this case, transportation is an instrumental right because it enables us to fulfill other fundamental human rights. So then, as examples apply to transportation engineering, right? Now we could be talking, instead of just unequal access to opportunities, we could be talking about like how in the chart there that you see, we have some groups that are in very low income groups, yet they, for example, have to travel significant distance to access job opportunities, right? And this on top of the fact that transportation is already the second most high expense at the household level, right? So imagine that on top of you gaining a low wage every month, you still have to travel even longer distances. Do engineers have something, can do anything in here? Yes, they can discuss these topics from the point of view of access to jobs, for example, right? And this is also an example of how these problems are not proportionally distributed in a space. They are sometimes concentrated in specific areas, such as in this example, in the case of counties in Indiana. Another important issue is like safety in the case of transportation, right? Like in 2022, more than 40,000 people in the US die in traffic accidents. And here is an example of how this number of fatalities are not distributed equally in the space, right? What you can see there is the space that are in dark blue are areas that have high percentage of fatal crashes, and also they have high percentage of African American population, right? So there's a big issue of intersectionality where we know that there are some systemic issues behind, in which engineers have something to do there. Okay, it's the same here in the case of, for example, same area in Tampa, Florida, with the case of fatal crashes and population, Latino populations there. So we see that there are some issues of inequity, perhaps environmental justice, but we could also use human rights language to talk about the same type of issues. And lastly, I wanted to mention another important point that came up also before in terms of the new efforts to tackle climate change. And we have been discussing a lot about how new technologies could help us solve these issues, right? But at the same time, we have been talking about how these new technologies could pose new and significant risks for human rights violations. And it's key, it's very important that engineers that now are analyzing, are discussing the supply chain of these very complex systems become very aware of the possible human rights violations that these new technologies may have, right? And that this does not follow the traditional path that we had before, in which the technology is developed just because technology needs to be developed, and then we try to figure out what are some of the environmental and possible social impacts of that. And this is just an example of the life cycle thinking, as it was discussed in the session of engineering education, and how each of those stages could be associated with a particular violation of a human rights article. Each of those bullet points is associated with a specific human rights article, either from the Declaration of Human Rights or ILO articles. But I want to point out, like, for example, something that came out in a question is, the destruction of raw materials. But we also have, even in the deployment of this new infrastructure, like, for example, think about the EV chargers, where are those located, who really can have access to electric vehicles, and really how is that we can benefit some of the communities that are located in EJ areas. With that, I would like to close by coming back to Mario and just thinking about how will be this community in 20 years. How this community may be in 30 years when we are bringing significant funds to develop perhaps new infrastructure. We are building perhaps their new highways, perhaps we are building a dam to provide water, but how can we ensure, Mario, that when that infrastructure, that investment happens there, we are not risking any kind of human rights violation for the community, and they can truly benefit from those improvements that civil engineers bring. And that's why we believe that a human rights framework could be very useful here. So that's pretty much what I have. Thank you. So now we have a few minutes for questions. I would like to open the floor for questions. We'll take 3 questions from the public in person, and then we'll take 3 questions online. Thank you.
Hi, thank you so much for those presentations. They're really great and always learning. I'm coming off of another conference about a month ago. I'm a civil and environmental engineer, focused on water equity issues. Got into it because I very easily saw that connection between water and it really being just so crucial. I think, Dr. Jones, you said it from the beginning, I was attracted to it in the same way. And so at this last conference I was at, it was a water and health conference. A lot of it was based in kind of international development work. And one of the things I was left with, the big topic was financing. And as an engineer, I hate touching that, but we know we have to. But one of the biggest things, so this conference is not just academia, because a lot of times we're around only researchers, but it was policy, it was water ministries from all around the world, and a lot of utility workers. And a lot of them were saying that talking about water as a human right was hurting the sector. And I heard that multiple times that week. And for me, that was flabbergasted. That to me was so in aligned with how the reason why I got into the field. But what they were saying is when as a water sector, because people don't think about the water sector until something doesn't work, the faucet doesn't turn on, something's broke. And that's how we kind of designed our systems, where people didn't have to think about us. It was something that was reliable and trustworthy, at least in the United States context, not speaking in a global context. And as that trustworthy has declined over the years, or as we've not been able to maintain our infrastructure, the willingness to pay for our infrastructure has decreased because people use the logic, which again, I'm not speaking from my positionality on how I view this, but there's not that willingness to pay for fixing the infrastructure and those types of things from the base, because for people's perspective is they expect that service because our programming, our marketing is that you should just expect water at your tap at this cost. And so I've been really grappling with that concept, again, because it's something I don't align with necessarily in just kind of that blanket statement, but it was really something that was being spoken about pretty openly in that space. And a lot of people were grinding with that concept. So I'm curious what your thoughts are when you hear that, when we think about, I think it's not just the water industry, it's a lot of the basic service industries as we're thinking about maintenance and trying to keep up our systems and provide access. How we as engineers advocate for these human rights, but also along the way are able to grapple with this concept of willingness to pay and cross subsidies and things that people kind of run away from, these concepts of how we actually can invest in them. So thank you.
Great, thank you so much. And I want to ask a related question, which is really interesting. So I teach and live, after 20 years in New York and growing up in Michigan where you paid for your water, I now live in a rural area where, and I know Catherine Flower's work in the Black Belt of Alabama has shown this, where people live in a trailer or people live in a home. There is an intergenerational transfer of wealth if you own the home, but you may be renting, and the septic blows out. And the cost of maintaining one's own water source when you're not on municipal water is really marked. And so I'm thinking also about these equity questions, which may not be as intersectional, although in some rural communities they are, but nonetheless provoke this question of what is our collective willingness to pay for this as a rights issue. Because the payment structure when one is in one's own home and has an inherited, let's say, leach field or well that not through any fault of your own ages out. You may have bought a house at a low value or maybe renting. And I keep thinking about the challenge not only in urban areas, but in rural areas, be they areas of color or not, for thinking through how we would look at public policy engagement around these questions, because we're not taking a rights view of this issue. We're looking at it as an issue of one's ability to pay for a service. And I'm very curious about how colleagues in the space who are working around water are grappling with the increasing weakness of the infrastructure across both rural and urban areas, which are compounded clearly through intersectional discrimination over many, many years, particularly in urban areas, but in some rural areas as well. And then in this zero-sum game environment, which we now find ourselves in, how you as colleagues, by using this emancipatory framing where we're all mutually bound up in our ability to survive under 72 hours with no access to water, we all die, how you are looking at the need to frame that in this particularly contentious moment politically.
Yeah, I have a bigger picture question for you to kind of give us feedback on. I think it's really useful to think about water and clean environments as being rights. I'm not sure I understand how transportation connects at the same level. And you mentioned it was an instrumental human right. I've not heard that term before. I've heard human rights instruments, which are, guidance and law. But I think, I'd be very curious why you connote those as in some ways equal, because I certainly would not myself put them as equal.
Well, I'm happy to start. And just one, thank you for the conversation around financing and water, because I think that is probably pretty central to a lot of the issues that we have around water. When you say something is a human right, and I guess where the conversation in your conference may have been coming from is it's thought, it's a human right. I shouldn't have to pay for it. It's my right. Why do I have to pay? But the truth is that, water infrastructure tends to be expensive. water infrastructure is not just free, but it's subsidized by, the tax base, which is why sometimes in areas that low socioeconomic areas, they don't, their water treatment plants can't keep up. If you look at a graph, there are graphs of the number of water treatment violations over the years, and there's a spike every time there's a new water regulation. There's a spike in a number of violations. They can't keep up because they can't retrofit their plants. They don't have enough money to retrofit their water treatment plants to meet the new regulations. And so they rack up violations. And this happens every time there's a new water treatment regulation. And so that's a huge issue. That's the reason you saw the statistics I put up, which has a number of Americans that, in communities that violate the Safe Drinking Water Act. It's because they're usually in rural communities or in communities where they just don't have the tax base to be able to pay for the water treatment plants being retrofit, for the new regulations. So that's an issue. So I do think we need to change. We need to sit with economists, and I was on another NASM, actually, a workshop on water, and they were talking about just our financing structure for water. Typically, it's public. Water is, you have a public water utility, and it's a combination of, it's usually public or sometimes public-private partnership, but it's paid for in large part by, the tax base of the community that it's in. And I do think we have to think about how we can minimize the cost, because I don't think cost should be an issue. I don't think a community's access to safe drinking water should be based on how much money is in that community. But that is very much what we see. A lot of those communities that have had even the ones, and there's so many communities that have water treatment issues that we just don't hear about. But the ones that made it to the news, most of those are because of the tax base in the communities that were affected. I mean, it's a finance issue. It's not a science issue. It's a finance issue. And so that is something, that's why I made the comments about, we really have to think about the tax base. Think about the finance structure for water.
Yeah, I love that comment. I think what I would add to it is that we need to figure out how to communicate to the public the ways in which it is their responsibility to take care of the other people in their community. Especially in the US context, a lot of cities are still quite segregated, and we don't interact with people who might be in different socioeconomic status, race, what have you. And I think that though I don't like the name of this theory, right, like the identifiable victim effect of being willing to give when you understand who you are giving to, I think is an important concept to consider sort of behaviorally as we're thinking about being able to have distributive equity, right? Not equality, but everyone being able to pay what they can in order to collectively support the right of water.
Eric, is there anything that you'd like to add?
No, I think this has all been well covered. Thank you.
Okay, thank you. In the area of transportation, thank you very much for that question. That actually allows me to bring two points. The first is related to how do we connect the work that engineers do with human rights, right? Specifically in the case of safety, for example. We could be talking about the right to life, right, Article 3, or we could be talking about the right to work, or even the freedom of movement. So the problem that sometimes is that we don't necessarily see the connection directly. So one of the key things that we have seen is that engineers will play significant role in enabling those particular rights. And this could go for both civil and political rights or economic and social rights. When we talk about civil and political rights, we might be talking about, for example, what software engineers do to preserve the privacy of things, right? And they can guarantee, for example, the right to vote, right? They are not necessarily impacting the right to vote directly, but they are impacting what the infrastructure that is needed for the fulfillment of that right. And it's not necessarily there at the same level of the fundamental human rights. However, they are very important for that fulfillment. And that's the way that we see that connection of engineering with that particular like whole body of human rights at the level of what the Universal Declaration has. But yes, they are not the same, right? Like, and it's the way that engineers can help realize those fundamental human rights is what we call instrumental rights. I hope that clarified that question. Okay, so now we have time for questions online, and if we have more time, we'll go for another round in person.
Okay, thank you. For the online questions, Dania Wright asks, specifically for Eric, what best practices would you recommend for current engineering professionals looking to enter more human rights-oriented roles, and for academics looking to connect and bridge industry professionals with practical human rights work? Patricia Evers asks, integrating these concepts into their existing work might feel big or overwhelming to people who do not have experience in this space. Where would you suggest someone start? And thirdly, can you explain the difference between taking a human rights-based approach to infrastructure design and universal design? Thank you.
Maybe I could start with the first question around how to get involved and where to start. It's a great question. I think anytime there's many avenues to get involved. I think both from a personal level and for professional organizations. I think there's infrastructure projects that are happening, again, globally across every community that would benefit from the input and technical capacity and direction of engineers. I would suggest for someone who's looking to get involved, there's many organizations that are based in the U.S. that do work internationally. There's also a whole subset of UN agencies that really focuses on infrastructure work. And that's probably where I would direct, engineering organizations who are looking to get involved in this type of work. There's organizations like UNOPS and UNDP and UNICEF that are always looking for qualified professional organizations to support some of their development programs. I think for the individual looking to get involved, there's organizations like Engineers Without Borders. There's organizations like the one I work for, Build Health International, that, this is our entire focus of work. And there's other similar organizations that are based here in the U.S. that are really geared towards kind of specific elements of infrastructure, engineering, and design to support, again, a wide range of human rights. We're talking about access to water. There's a lot of organizations that are focused on providing engineering solutions for water access and sanitation access. There's organizations like the organization I work for at BHI where we're focused on healthcare. So I really think it's about identifying, kind of your direction and passion and where you'd like to get involved, and then kind of reaching out and getting in touch with those organizations to seeing what the opportunities are to engage and be a part of that work.
I'll address the question about how do you integrate these principles into your work, because it's something that I began to think about. I think I mentioned this earlier, but I became very interested in actually moving beyond just, research and design. I'm a researcher. I've been doing research for a number of years, and thinking about how my research is actually implemented and whether people who actually will be engaging with what I design, whether they are at the table and what role they have in what I was doing. And so I think it requires a very intentional, it doesn't just happen. Most of us who are engineers, depending on where you work, I don't think right now you would necessarily encounter a situation where you would have to work with the community, for example. But I will say, and studies have shown, that working with communities, especially when you're designing something that will impact those communities, if you work with the community, your design will be better. It'll be adopted in a better way. It'll work better for the community. It will be better. And so I think just educating the next generation of engineers to really understand this and take this on as a way that they do their work will be a huge step, in my opinion, in the right direction in terms of really engaging those communities at the front end. We're having our early conversations about engineering or design or any of these things.
Perfect. So very quickly, I'd like to address the question on the difference about human rights-based approach and universal design. And this actually allows me to explain something because we've been asked this question before. And for example, how is different engineering and human rights versus, for example, social justice and engineering, or versus some other frameworks related, for example, to humanitarian engineering. And what we say here is that this is not a framework that, for example, it's going to compete with any other framework, it's going to replace. What we say is that engineering for human rights, what it does is set the principles that could be used in any other framework. Like, for example, you could still be doing universal design, but when you're doing universal design, you'll be addressing human rights issues, right? You'll be respecting human rights. If you're doing humanitarian engineering, you'll be doing the same. You'll be considering what are the access to health, access to jobs, access to education, being free from forced labor or child labor. All those things will still be part of the framework. So in some way, these are not competing frameworks. They are actually related, and human rights could be included in any of these other frameworks. Thank you.
Thank you very much for the panel. Go ahead. You may. We're going to take a break of, it's going to be about 10 minutes, like I said, and then come back in here, and Davis is going to come back to the podium, and he's going to explain to us how we're going to do the next session, which is sort of a case study, which I think you will find very interesting.